Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is the basics of sciatica. Sciatica occurs when one of the nerve roots of the sciatic nerve is pinched. The sciatic nerve is not just one nerve, it's actually a confluence of three lumbar nerve roots, L4, L5, and then actually S1, first sacrum. It comes together and forms a sciatic nerve and runs down the back of the leg. Okay? 1 to 2% of the population suffers from sciatica at any one point in time. The most common reasons it occurs is from a herniated disc or spinal stenosis. Less common reasons may include nerve root irritation from degenerative disc disease, a tumor, or a problem after the nerve roots, meaning the nerve roots are here, it comes together from the sciatic nerve, something down in here as it's coming out of the pelvis. How does it occur? When a disc degenerates, the outer layer may tear and part of the inner jelly can squeeze out. Okay? Here's a disc, it's usually an ellipse, and then if the outer layer tears, some of the inner jelly squeezes out and can pinch on a nerve root. That in and of itself is not painful. It may cause weakness, but it's not painful. It becomes painful when this sparks up inflammation, so you see here that as red, and the inflammation irritates the sciatic nerve, and the pain can go down the leg. Okay? The symptoms of sciatica may vary. It may include a burning sensation, electrical, pins and needles, numbness, motor weakness can occur, and then rarely incontinence. That's a surgical emergency. How's it diagnosed? History and physical is the most important part. Sometimes patients walk right out of a textbook and you know exactly what's going on. Other times it will need to be correlated with things like a straight leg raise test, which is where the pain doctor lifts up the leg straight, puts tension on the nerve roots, causes extreme pain if a disc herniation is present usually. And then when the doctor flexes the knee, the pain usually goes away. And then an MRI, such as you see here, where you have a disc here and a disc herniation, a very large one, if that correlates with the patient's symptoms, then that's very specific. Okay? A nerve conduction may be necessary to order. And then if all of that is really unclear, a diagnostic injection around that nerve root may help. There are lots of treatments available. Used to be thought that a week of bed rest would be great, not so good according to research studies, so limited bed rest of 24 to 48 hours if necessary. Medications may include over-the-counter anti-inflammatories and Tylenol, muscle relaxers by prescription, along with neuropathic medications. These may include Lyrica or Neurontin. They may be beneficial. And then short-term opiates for pain relief. Physical therapy and chiropractic have been shown to be very helpful. If they can be tolerated, you may need to have the injections first. A TENS unit, which you see here in the upper right, is about the size of an iPod. It's got these foam pads coming off of it that go over the skin, and that can help change the way the brain perceives pain signals with the electrical stimulation. Acupuncture can be helpful. Spinal decompression therapy is computerized intermittent traction. This has been shown to be over 85% effective. And interventional treatments may consist of trigger point injections, which are subcutaneous and can help with a lot of spasms. And there are several different types of epidural injections, such as you see here. You have a disc herniation, pinching on a nerve root as it tries to get out, and this bathes that area with soothing steroid medication, providing pain relief. Outcomes with sciatica treatment: over 95% of patients are successfully treated without surgery. There was a landmark study in 2006 showing that the one-year outcomes between operative and non-operative patients was completely identical. Indications for sciatica surgery: if you have bowel or bladder incontinence, that's a surgical emergency, and that's called cauda equina syndrome. A relative indication would be muscle weakness, especially if you have like a foot drop and it's getting worse. Anytime a muscle weakness is getting worse, that should be an indication for surgery. But if it's a weakness that's not getting worse, it can be watched for a while. But if you start to watch it longer and longer and longer, you may end up in a situation where it doesn't matter how technically perfect of a surgery the doctor does, you may not get better at all. And then for simply pain with an elective indication, 6 to 12 weeks of failed non-operative treatment should be tried. And if it fails, then you can go on to have the surgery. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the Dallas-Fort Worth Metroplex area, accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online today at painmanagementdallas.com. And then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.